let's have a solution that provides effective treatment without those negative side effects and actually, first and foremost, provides effective treatment.
Welcome to Nano Matters, the podcast that explores specific examples of nanotechnology. I'm Lisa Friedersdorf, Director of the National Nanotechnology Coordination Office. Today, I'm joined by Angelique Johnson, CEO of MEMStim LLC, a company that makes spinal cord stimulators that can help people with spinal cord injuries. So, Angelique, what is a spinal cord stimulator and how does it help in spinal cord injuries?
So spinal cord stimulators are used both for spinal cord injury and also for various types of chronic pain and the various types of pain that can be treated with spinal cord stimulators. You could have chronic leg pain or arm pain, complex regional pain syndrome, pain that's associated with cancer, various types of pain from various regions of the body, but these regions of the body are sending pain signals through the spine up to the brain. And when you take a spinal cord stimulator and you're putting it into the spine, you have your spinal cord, and then as we all kind of are mostly familiar from kindergarten, the shape of the vertebrae, that's kind of protecting this relatively fragile spinal cord. Well, the spinal cord stimulator goes inside that vertebrae and lays on top of the spine. And it's basically masking pain signals that are coming from various regions of the body from actually getting up to the brain, or is changing the way the brain perceives those signals. And then you have spinal cord injury that results in maybe a form of paralysis. There's some wonderful work going on at University of Louisville Medical Hospital. They have a center that is actually using spinal cord stimulators to rehabilitate individuals that have been completely paralyzed in various regions of their body, unable to walk. And they found out that if they put a spinal cord stimulator in the spine, they basically awaken these processes that are within the spine, control centers almost within the spine, and they can use the device with the assistance of treadmills and different walking devices, rehabilitation devices, to restore functionality, movement to these individuals. So it's definitely an exciting field, and there's many applications that I haven't even mentioned that are coming up in the future.
So how did you get inspired to work in this area?
Well, MEMStim, we started out in the cochlear implant space, and we still do a lot of work with cochlear implants, which are basically not literally implantable hearing aids. It's actually a different technology, but for a layman, they're hearing aids that are implanted inside the cochlea. So they're actually done with a surgical technique. And they're using technology, what I call pacemaker-like devices. A lot of these implants in this field started out with pacemakers, which many people are familiar with. You can take those pacemaker-like technologies and put them in various parts of the body. And we start out working on cochlear implants. And then we started saying, hey, with the use of nanotechnology, we started creating these smart materials, started creating these highly flexible devices that could go in really small and tight areas within the body. And we said, hey, where else can this technology be used? And spinal cord stimulators really just leaped up into our mind because of the opioid epidemic, because of the advantages of being able to use nanotechnology and make very soft, flexible materials that can be rolled up and implanted in a very minimally invasive technique within the spine, because of the technology we were generating around, just being able to potentially embed sensors and things into the technology. So there's a lot of improvements, enhancements, and therapies that don't exist now that can be created by, in a sense, tapping into the spinal cord and tapping into what's going on there. And MEMStim certainly wants to be a part of that because it really, again, it just makes a huge difference on people's lives when they have chronic pain, when they have spinal cord injury. It really does affect the quality of life and how people end up living their lives.
So how does nanotechnology play a role in this technology?
We take nanomaterials and we can do wonderful things like make elastic metal. It's good also both for a sensor as well as a stimulator. So you're able to, in a sense, avoid a lot of the breakage that happens with current spinal cord stimulators. The back is always bending. And so you end up seeing a lot of device failures over time. We're able to add sensors onto the spinal cord stimulator lead so that you have this closed loop control over the system, whether that's pain management or again, looking at spinal cord injury. And many of the technologies, if you sense pain, the user has a remote control and they kind of start treatment. But you want really to have this technology to the point where you don't have to even think about it. It's just all kind of being controlled as you go about your daily life, blocking pain before it even reaches your sensory system.
So this technology is an opportunity to deal with pain management in a very different way. Is this a potential part of the solution to the opioid crisis?
Absolutely. And you have this crisis because people would get these pharmaceutical treatments, and the pharmaceutical treatments were maybe somewhat effective, but they wear off. And so people need higher and higher dosages of this, and then they become addicted to it. But with spinal cord stimulators, there's no addictive effect to it. It's literally a technology that goes in the spine. It offers treatment. And when it's not offering treatment, there's very few seriously adverse side effects as opposed to, again, pharmaceutical treatments. But then for spinal cord injury, there's no drug for paralyzed individuals, to make people walk again. A lot of times when people are looking at spinal cord stimulators, whether it's chronic pain or whether it's spinal cord injury, they're really at the end of the road in terms of what can be done surgically, what can be done with opioid solutions. Let's have a solution that provides effective treatment without those negative side effects and actually, first and foremost, provides effective treatment.
So where do you think this technology will have the most significant impact in the future?
There's going to be a whole host of advancements that we would want to see in this space. And one of those things would be if I have a spinal cord injury and I'm looking to have this device implanted in my spine, how can I reduce the surgical complications that are associated with that? So what we've done at MEMStim, we generated this really thin spinal cord stimulator lead that we can actually potentially roll up and insert just with almost something similar to an epidural needle, which a lot of people are familiar with. So there's 2E needles that you can use now to implant spinal cord stimulators. But the stimulators that you can implant, because the needle opening is so small, only has a few electrodes on it, and they're all kind of like ducks in a row. But for spinal cord injury, you really want to cover a broader surface area of the spine. So you want an array of electrodes, and that creates a broader device that you have to do a more complicated surgery for. Well, MEMStim, we want the best of both worlds. So we want that broader electrode with many more electrodes on it. Well, we can create many of them on what we call a paddle lead. And instead of having to do a more complicated surgery for that paddle lead, you can just kind of roll it up and stick it through this 2E needle and reduce the side effects that come with those more complicated surgeries.
Well, I want to thank you for taking the time to talk with us about how you're hacking into the spinal cord and using stimulators to treat spinal cord injuries. Could you share any closing thoughts that you might have for our listeners?
Although we're focusing specifically on spinal cords, we really create different technology for an area that's called neuromodulation, or you might hear the term neural stimulation. I call them pacemaker-like devices. Well, all those technologies are basically stimulating nerves and neurons in the body to offer some sort of therapeutic treatment. So it could be something from hearing, like we talked about with cochlear implants, to blindness that you see with retinal implants. I haven't had a talk yet where somebody hasn't come up to me after the talk and said, hey, I have a relative or I myself am suffering from some sort of neurological disease or disorder, and there's not a pharmaceutical treatment for it. Do you think your technology could be used for it? And my hope, and I really do see this happening, is that although right now the field is somewhat restricted to, chronic pain, hearing loss, vision loss, that in time, there's going to be so many more neurological diseases and disorders that can be treated with neurostimulators. And at MEMStim, we just want to build the technology to enable that to happen. And I just think it's such a fascinating and impactful space to be in.